Introduction, an overview of LED light therapy. Nowadays, light therapies are becoming one of the most efficient and effective ways to cure many types of chronic pains, which were earlier unable to treat by simple drugs and medication. Light therapy is also called heliotherapy, that consists of exposure to light of specific wavelengths, using an LED light, photochromatic polarized light, fluorescent lamps or lasers. The basic lights that are used for curing chronic pains are LEDs of infrared color. It has been analyzed by the physicians and researchers in many cases, where the patients can get better relief from LED light therapy, more effectively as compared to medication and drugs. For example, there are many chemotherapy patients who were seriously injured from an accident, or patients who have had chronic pains for many years, where LED light therapies have provided relief in a concise period of time. If you are also suffering from any pain in any part of your body, this is a chance for you to try the revolutionary LED light therapy technology that can provide you with a life free of pain and suffering. So, stick to your computer screen for a few minutes and watch this detailed video to know the secrets of light therapy. What is the reason for pain? Have you ever imagined why you are feeling pain in a certain part of your body? Did you ever try out to find the real reason for your pain? Pain generally occurs whenever any part of the body is not fine and having any issues. Pain is necessary to understand the various issues inside the body, and it alerts the nervous system to take alleged actions. Pain is beneficial in some cases, and it can alert you to take necessary actions as soon as possible. For example, when someone falls, then he can understand where the injury has occurred by simply realizing the main location of pain in the body. However, sometimes pain is not plausible when it becomes chronic. There are three types of pain: somatic pain, sympathetic pain, and nerve pain. When a person feels pain on his skin, joints, muscles, ligaments, then it is generally called somatic pain, or musculoskeletal pain. The pain receptors generally become sensitive to the stretch of muscles, temperature, and vibrations. Sometimes this pain may also occur due to a lack of oxygen in your body when the ischemic muscles cramp. Nerve pain often becomes chronic pain because it comes from within the nervous system of the person. Some physicians often refer to this pain as trapped nerve pain because it occurs due to trapped nerve. This type of pain can generate from the nerves between the spinal cord's tissues, and sometimes the nerves between the spinal cord and brain. Finally, sympathetic pain occurs generally after a fracture, wound, or injury of soft tissues inside the body. This pain is non-nociceptive, or there are not any specific pain receptors in such type of pain. In this type of pain, the nerve that was damaged becomes unstable, and that's why it sends abnormal signals to the brain that interprets it as pain. Recently, many researchers have proved that light therapy is more effective than any other types of cure, like medication, drugs, or massage therapies. One common reason for this is that the LED lights can penetrate very deep inside the skins and rejuvenate the human body's cells, nerves, and soft tissues. NASA has also researched the effects of light therapy on the body by doing many kinds of research. How do drugs work on pain? Pain in any part of your body is generally detected by the nerve cells, called the nociceptors. As the person grows, nociceptor cells are installed in every crucial part of his body to detect pain. Nociceptor cells conduct electrical signals, just like any other nerve cell, and send signals to the brain about any kind of pain. However, these nerve cells only stimulate when something bad happens to a person's body that generates pain. For example, when you put one of your fingers on a sharp needle gently, then you would not feel any pain. If you put some pressure on the needle, then the nociceptor cells cross its threshold and stimulate and send signals of pain to your brain, and the brain will ask you to stop. But this level of threshold for pain can be disrupted by some chemicals like prostaglandins and others, and tune its level down to a very low level. Actually, prostaglandins are released when your body is injured or damaged, and when they are released, Then the nerve endings respond to it, by picking up and transmitting the injury and pain messages to the nervous system. However, this natural process is disrupted, due to some reasons for some people. In that case, the person would start feeling pain, at a simple touch of anything. When the cells of a person's body are damaged, they can start creating these prostaglandins, and other chemicals, at a very high level, lowering your nociceptor cells threshold. This is where the drugs, like aspirin and ibuprofen, come to the rescue, that can lower the amount of chemicals responsible for lowering the threshold of your nociceptor cells. In many cases, the researchers realized that these drugs also stop working when the pain itself generates in the nervous system of the person, likewise, in the case of nerve and sympathetic pain. In this case, light therapy is the best way to cure the pain, because it can also rejuvenate your brain's nerve cells, without any side effects. NASA itself checked the effects of LED therapy irradiation on molecular changes in wounding healing in diabetic mice, and the results were fascinating. The researchers at NASA had found that the use of LEDs generally enhanced the healing process of wounds, and returned the patient to a healthy condition from an injury. How light therapy works to relief from pain? The researchers had found some phenomenal results when they used the infrared LED lightings to cure chronic pain. The reason why LED infrared lights have been so significant to relieve chronic pain is because of their penetration power. The penetrating range of blue light is around 2 to 3 millimeters in depth inside the skin. Red light can penetrate to a depth of around 8 to 10 millimeters. Meanwhile, the infrared light has a very high penetration power of around 20 to 100 millimeters inside the skin of the human body, and that's why the effects of infrared LED lights for the cure of chronic pain is quite significant. The infrared LED lights can penetrate deep inside the body to rejuvenate the body's damaged cells, tissues, and nerves. The working principle of LED light therapy is simple: it penetrates the body's nerves and stimulates the release of nitric oxide from the hemoglobin into the person's bloodstream. Now, when nitric oxide is released from the hemoglobin, it enters the muscle cells in the blood vessels' walls. The nitric oxide stimulates the muscle cells of the blood vessels' walls, and then the muscle cells relax and enlarge the diameter of blood vessels, thereby allowing more blood to flow through the vessels. The main reason for pain, in many cases, is the blockage of blood vessels. For example, when you tie your finger tightly with some thread or rubber band, and then release it after some time, then you'll feel pain. So, light therapy can relax your blood vessels and increase the flow of oxygen to the main parts of your body and brain, which helps in rejuvenating the body cells. The production of nitric oxide in the human body can also increase ATP, adenosine triphosphate, which is the main source of energy to the cells of the human body. The human body cells use the energy of ATP to recover themselves from damage caused by injury and inflammation. Meanwhile, ATP is generally formed from the oxygen and glucose present inside the human body. So, the production of a reasonable amount of nitric oxide in the human body by the LED can increase the oxygen level, thereby accelerating ATP production and absorption by the body cells. This acceleration has been quite impressive in case of damage to the body cells due to injury, accidents, or inflammation. Researchers have found that infrared LED lights have been remarkable to accelerate the process of ameliorating the damaged body cells, thereby accelerating the process of healing from any pain from accidents, injury, or inflammation. As it has already been discussed in the earlier section, that some type of pains generates from the nervous system itself, like nerve or sympathetic pain, and drugs are not plausible in such cases. However, LED light therapy is significant in such cases, because it can recover the blood vessels' normal functioning by increasing the blood flow inside them. This is why many physicians are now recommending infrared light therapy to patients with chronic pain. Light therapy has become a revolutionary way to cure chronic pain. There are many researches done by some well-known organizations, like NASA, that validates the effect of light therapy for the treatment of chronic pain. You can rely on the quality, and use it without any worry. LED infrared light therapies can be simply used in place of regular heating pads, because there are no serious side effects. However, it has also been analyzed in many cases that LED lights are sensitive to the skin of some people who are sensitive to light, or have any kind of allergy to light. It is possible that some minor rashes may happen to those people while using infrared light therapy. So, you must consult your physician or a dermatologist before you start using the LED light therapy equipment. If you are really serious about getting rid of your chronic pain, then we have a very good offer for you. You can click the link in the description and watch a free presentation for how to get rid of your chronic pain. So, please watch this presentation. If you loved this video, then please like it, give a comment, and don't forget to hit the subscribe button and bell icon. This will let you watch our videos instantly whenever they are uploaded on our channel.